Well, unless you've unlocked the secret to immortality, the inevitable next stage in life is death. But according to today's guest, the silver lining is that the type of end-of-life care you or a loved one may need is getting better. Here to discuss is medical expert Dr. Poonam Alaigh. Thank you for joining us.
Thank you, Jessica.
So what are the current issues that are surrounding end-of-life care?
You know, end-of-life care is an extremely important piece of how we deliver health care. And again, I'm glad you set it up. I mean, death is inevitable. It is the stage of life, the reality of life that we all are going to be facing. And there are about 2.4 million Americans who die every year. 70% of Americans want to be dying at home. However, 70% of Americans actually die in a place other than home, either in a hospital or an institution.
And why is that?
And again, when we talk about our personal choices and when we sit back, think about the time that we're all going to be facing, which is death, right? Would we rather be in a hospital, in an ICU bed, attached to machines, attached to tubes, not knowing what's around us, and alone and destitute? Or would we want to be at home with our loved ones, with our friends and family, and celebrating a life well lived? And most of us want that. So 70% of us want that. However, the system is such, the society is such, the healthcare community is such that we can't, most of the time, can't make that happen for individuals. The physicians feel, the healthcare community feels that one should not give up, and the context is curing disease. We expect miracles. Society feels that everything and anything should be done to prolong life, and a lot of times it's actually prolonging death, not prolonging life. And the system is set up where we don't have teams in place up until now where we can actually talk about these sensitive issues, where we can understand what those personal choices and cultural influences are, where we can be transparent about the prognosis of disease. And really, at the end of the day, would we want to be going through all this, the few months we have left? Would we rather spend that time with our loved ones, or would we want to go through the hospitals and our healthcare system and keep getting medications and treatment, knowing that all that's going to be futile at the end?
Right, and that's an important point that you just brought up, that it is futile, and that most of the spending from Medicare, 30% in fact, I believe is what you said, that is what is spent in the last year of a patient's life. Now, how does that affect us as a society?
I think that's a really important point. So it affects us as a society because we want to do the right thing in terms of quality of care, in terms of great outcomes. At the same time, we're actually burdening the cost of care, right, as a society. So where we could spend those dollars to help cure disease and help improve life for patients who are dealing with devastating diseases, we're actually spending 30% of those dollars in the last year of a patient's life when we're not seeing any change in outcomes. So that is an important piece. That is something that we realize, and so as a society, we're working in a multi-pronged approach. Healthcare physicians and professionals are getting more and more comfortable talking about the fact that dealing with death can be, is very professionally gratifying. It is the right thing to do. When we, as a physician, I'm proud to be a physician, took the oath, we said first do no harm, and sometimes continuing to treat is actually doing more harm than curing. As a society, patients and their loved ones and their caregivers have to be comfortable with the fact that the decisions that they're making are the right decisions, and that giving up is not actually losing. It's not, sort of getting into the state of, defeat, but it's actually making sure that you're getting the dignity and respect that you need throughout your life, including at the time of death. And as a system, we're developing certain palliative care teams. These are multidisciplinary teams that consist of nurses, social workers, physical therapists, bioethicists, nutritionists, all these kinds of support services, because all this is needed.
Right.
End-of-life care is not giving up. End-of-life care is continuing to deliver the right care so that patients can live to the end of this phase of life with the most dignity.
Right. Now, all of these specialists are probably not as available as they are here in the Northeast as they are across the nation. So how does what is the disparity with people in different regions, people with different religious backgrounds, beliefs? What type of care are they receiving? Is it very different across the country?
Yeah, and Jessica, that's a really important point, because depending on where you are in the country or even in the world, care during the end of life is different. And as a result of it, the cost of care is different. So there are places in the country where the cost of care is 2 to 3 times what the average cost of care should be in the last few months of a patient's life. But we see no improvement in outcomes, no improvement in quality, no improvement in satisfaction. And so these things are going to be critical. We have to bring the right resources. We have to be sensitive to cultural needs. There's a lot of fear and mistrust in some of the ethnic communities that we have to overcome as a society and as a healthcare team. So those things truly do exist, and we have to deal with it.
It sounds a little dismal, so please tell me there's a silver lining. There's something that people who are looking for end-of-life care can look forward to, can look into. Are there any resources that you would suggest our viewers look into?
Again, this is the state of affairs, but there is a lot of research that's happening, a lot of good programs that are coming about as a result of it. And so we're seeing patients who are actually being admitted towards the end of life going down in terms of the length of stay. So more and more patients are shifting into the homes, more and more patients are enrolling into programs like palliative care and hospice, more and more are communicating with physicians, their advance directives, their healthcare proxies, things like that. I am
going to stop you there, but talk to your doctor.
That's the
message that we want to convey. All right, well, thank you so much for joining us. It was very, very informative.
Thank you, Jessica.